have you called your buddy today. It's Buddy Chuck 12 Day, and it's our First Coast News. Always, we're encouraging everyone to call their buddy and remind her to do her self-breast exam. That reminder, along with getting the best care possible, can be a lifesaver for many. So we have Dr. Ali Kazryan joining us today for the Weekly Dose, and you brought along a very special woman today, your mom, Dr. Shalad Masood, right?
Yes.
Masood,
Yeah,
nice
yes.
to have you both.
Thank you.
As always. So we're going to talk about breast self-exam today, or breast self-awareness as you were calling it, because that's really important.
Exactly.
You have a forum that's coming up, and we're going to discuss that later. But let's talk about, I guess maybe it is really important for men and women to know about this.
Absolutely.
And diagnosing.
Absolutely.
So let's go into diagnosing first.
Well, fundamentally, I think the most important thing that we need to be aware of it is everyone has to have that self-awareness. How the breasts look like, how do they feel, and therefore when they see any changes, naturally the best thing is to just refer to your physicians. Let them make a decision, let them do the clinical exam, and let them decide whether a patient needs imaging, mammogram, ultrasound, tomosynthesis, MRI, and the other component of it. So from that point of view, I think the most important concept is understanding that when breast cancer is detected early, that is a manageable disease. And majority of breast cancers that they are low grade, which they are majority of breast cancers that they are in that category, these are the tumors that should not be even regarded as a fatal disease as the perception is. This is just a chronic disease, and you need to be under the care of multidisciplinary qualified physicians so that they can take care of you. But the most important thing is follow the guidelines for mammography and screening, and be aware of your body so that if there are changes, refer to your physicians.
And that's for men and for women.
This is for men and women.
But the thing is, I mean, I feel like there's such anxiety. I mean, you know, and Dr. Ali, you may be able to speak on behalf of men. I feel like there's such anxiety to do your breast exam. So for someone to remind you, like in the Buddy Check 12, it's important because we're anxious to do it sometimes.
It's awareness. I mean, with this, you know, even doing the self-exam, when you look at the literature, is very controversial in terms of whether or not it actually benefits finding more cancers, what the healthcare costs are in terms of false exams and false tests. However, it kind of doesn't make much make any intuitive sense, being that it doesn't take much for you to do a self-breast exam, whether you're a man or woman, similar to testicular exams, self-testicular exams. And what Mom is saying, and what seems to make a lot of intuitive sense, is if you feel something that is different, go talk to the doctor, because that clinical breast exam where a physician is doing on a regular basis can complement what you're noticing yourself. And with this, as Curtis may appreciate, this very much like curling, you know, managing diseases and personalized care depends on accuracy, precision, and teamwork, and you're the biggest player in that team. And so doing all that is very, very important, and having a multidisciplinary team that understands breast cancer is very, very important.
Yeah, I like that analogy. That's a good analogy.
Curling's
Let's
important.
go into, I know, right? Well, let's go into treatments, though, because that's most important, and especially for maybe somebody who's newly diagnosed. Let's talk about treatments.
Well, the treatment, again, the concept has to be understood that breast cancer is not a single cancer, or is not a single disease. It's a family of diseases, a family of breast cancer, and every single one presents differently. They have a very specific character, and they have different biological behavior and outcome. In that sense, I think the concept of we call everything breast cancer is no longer really acceptable. We need to specifically know what kind of breast cancer it is, because for each one of them, there are different options for therapy that is available. Different protocol, different approach, and different concept. And right now there is a movement that for low-grade, early cancer, for patients specifically that they do not have any risk factors, maybe cancer therapy has to be really totally modified for those people. Therefore, the concept that we are sort of following, and what we are trying to do, is to educate the public so that they know and understand that majority of the breast masses are benign. So they don't have to go to that extreme anxiety about that. Refer to your physicians, know what it is, and then talk to a qualified person to tell you what kind of cancer you have and what are your options for therapy.
I like, Dr.
because they're
Masood, that
different.
you said that most are benign, because
Yes.
that automatically just releases a
Absolutely.
bit of stress for people.
Absolutely.
So let's go on to, you have, so talking about education, you were talking about education is key. You have a forum that's coming up. Let's discuss that.
Yes. Well, within our system, basically, we have designed this public forum, what everyone should know about breast health. And we have a multidisciplinary team of physicians from different disciplines that they are being placed in front of the public. And then they ask the question and we answer their questions. It's a dinner session. It's free to the public. There is no financial, there is no marketing component associated with that. And what all we are doing is try to make sure that the patients know and the people know what breast cancer is.
Dr. Masood, Dr. Kazraian, thank you so much for having you both. Appreciate it.